Hello and welcome to our podcast. I'm Dani, and today Great.com talks with Justin Anantawan, the Harm Reduction Coordinator of the Asian Community AIDS Services. If you haven't heard of it yet, they provide safer sex education and services to the East and Southeast Asian communities and support services to persons living with HIV/AIDS and members of the LGBTQ plus communities. If you're new here to this podcast, press subscribe on YouTube or in your podcast app. Hi, Justin, and welcome.
Yes, thank you for having me. Appreciate it.
It's a pleasure, Justin. I feel like this series that we have started a while ago has been giving us such an opportunity to understand better the intersectionalities, the very specific needs that different communities have. And having you here today, it's going to be amazing to expand this knowledge that we're trying to build here. This perceptions of how, even though we share common challenges, some things differ, they vary from place to place. Let's begin learning more about what was the history, the inspiration behind the founding of the Asian Community Aid Services.
Yes, so Asian Community Aid Services. So obviously I wasn't around when it got founded. I mean, I was alive, but how old was I at that time? Like I was 6 years old when it got founded, so I didn't obviously know about it. But basically, it was started on December 1st of 1994. There were, I believe, three East and Southeast Asian groups that were basically serving folks in the East and Southeast Asian community in terms of, I guess, HIV prevention and uh, and education, basically, and so these three groups got together, um, and they started a coalition that was called Asian Community Aid Services. Um, and I believe one of the founding members was a person named Dr. Alan Lee. Um, I forget the names of the two other people who founded it. But basically, that's how it was started. And I think the reason why it was started was because um, a lot of the, and even I don't, maybe it makes sense still today, but especially at the beginning of the the HIV/AIDS epidemic in the 1980s and 1990s, a lot of the materials and for awareness, right, of HIV and prevention didn't really focus too much on East and Southeast Asian folks. It was very, very, you know, very much Euro centered on white folks, basically. And so they found that yes, there's a need for our community that's not being served, and that's why it was started. Um, and over the years, it's developed, and our community is very vibrant. It kind of we focus our community is very much based on it's a South and Southeast Asian community, but it's also very much the LGBTQ community in Toronto at this time, right? So, um, but that's how it was started. Basically, there was just a need for, especially in terms of languages, right? For our for our community, and it wasn't being met, and that's how they started. Yeah.
I love to hear it because you bring already some of the elements that I feel it's important for us to understand better, right? You're talking about these needs, and I wonder how much of this needs, not just from the needs before, but what's going on right now. What are these challenges that the organization still are trying to bridge? What are the specific challenges that you guys are facing?
Yeah. So specific challenges again include just creating materials and education materials and awareness that's geared towards East and Southeast Asian community, just because again, when you don't have information that is in your own language, right? Firstly, that's a huge, and we have a lot of folks who are coming from countries where, they only speak Chinese, or they only or like that's actually our community. Like a lot of our members are immigrants from China, for example, and when you don't have that information that's tailor-made for you, you're not going to access services, right? In terms of treatment for HIV, testing for HIV, sexual health services, and also in general, in a lot of Asian cultures, we tend to be a little bit conservative when it comes to talking about sex, right? Sex is a very taboo subject, and so what we try to do with ACAS is we really try to build capacity within our community to really talk about these issues. Even for me, like working in the harm reduction field, right? Again, in our culture, talking about drugs is and substance use, harm reduction, all that stuff, addiction, it's very taboo, right? Because, for example, like within Asian culture, there's often, a such pressure put on productivity, right? And then substance use is seen as something that's going to take away from that productivity, right? And so there's always so much discouragement. Do not use, do not use, do not use. And if you do, you're like kind of like a deadbeat person. Um, so there's a lot of stigma within Asian community. I hear folks say, in our community saying quite a few stigmatizing things about people who use drugs, for example, that they're unsafe and that I don't know, they're making the streets unsafe, for example. And the same thing in terms of HIV as well. There are quite a lot of folks in the Asian community who are very stigmatized against HIV. And for example, I think I met one nurse who was part of our Asian community, and she told me that she didn't want to wash the dishes at the hospital where her other fellow staff were working because she thought she could get HIV from washing dishes, which is completely untrue. Right? That's just an example of it, right? Uh, and then, there's also a lot of issues too where you'll have Asian folks, especially international students, they come here and they find out in Canada that they're HIV positive, right? Or I've had Asian folks who are about to come to Canada who want to come to Canada but are HIV positive, right? And they're asking me, where in Toronto is there an organization that can help me once I get there, in terms of helping me find treatment, because again, accessing when you're not, again, like HIV drugs in Canada are not free. Unfortunately, like you have to pay like a lot of money and so you're going to have insurance, and we do have some programs in Canada that are able to um, help pay for HIV drugs. But when you're a new immigrant from, let's say Indonesia, and you get here, right? You're not really sure where to even start in terms of getting access to these drugs. Because unfortunately, whereas in a lot of countries outside of Canada, like HIV drugs are free. Like for example, I've worked in Gambia, Jamaica, and Kenya, and all those countries, um, HIV drugs are free. And even I'm actually HIV positive myself, and when I was overseas, I was able to very easily access those drugs even as a foreigner. But here in Canada, like unless I have insurance, I'm going to be paying um, at least $1,500 a month. Yeah, Canadian for HIV medication. So imagine if you're like an immigrant from another country, an Asian country coming in here, and you know, maybe you were used. I'm not really sure what it's like in other countries in Asia if they give it for free or not. But let's say it was free and you come here, navigating that whole system, especially when English is your second language too, right? So So that's where Asian Community Aid Services comes in. We support people in those kind of situations. Yeah.
Oh, I think it's major, the work that you guys are doing. And I did not know about this fact in the treatment in Canada. If I'm not wrong,
Oh
I think you
yeah.
live in Brazil, it's free as well. So it's kind of crazy to
Yep.
think about it. Yeah.
It's ridiculous. And I, I mean, it's ridiculous, definitely, and it doesn't make any sense to me that we're, living in a developed country per se, and yet people have to pay so much money for these drugs. Yeah.
Yeah, absolutely. Especially considering the health system that you guys have, like it would be possible, I
Yep.
believe. It would be possible. So maybe I think it's the kind of thing that we forget that it's a public health question, right? Not that it's a big thing, but it's about the public, it's about the society. So we need to have the rights to access that. So
Yeah.
yeah.
Exactly.
Now, you mentioned these things, and I kept wondering first, how far can you actually like go, and how many areas you're covering in this health? Because you mentioned here helping navigating sex education, and then you are involved
Mhm.
in harm reduction. So
Right.
there is a lot of ground being covered by you guys. So could you tell us more about the services that you have?
Yeah, so we have a lot of different services. We have. Forgive me if I don't remember all these things, but I'll try as much as possible. So, the different services of ACAS is we have, for example, support program. So, the support program specifically is for PHAs, people living with HIV, and the person. I think there are two people right now running it at our organization. Alex Lam and June Loy. And I do believe there's yeah, and they're really amazing. So basically, they connect PHAs like myself. Even I'm actually part of that support program too. To different services. So, for example, connecting them with housing help. For example, if you need affordable housing, like we had a clinic for that. There was a tax clinic recently for HIV positive Asians who wanted to need help with their taxes. Um, we also like that program also provides acupuncture to PHAs, and that's a really great thing, because PHAs, a lot of for us, we often struggle with not only HIV but other health issues too, like mental health problems, maybe immunodeficiencies or just stress in general, right? And so we have that acupuncture as part of the support program. There's also we're also connected with a college called Oxford College in Toronto, and they provide, and their students are actually in training, and they give free massages as practice to Asian PHAs like myself. I've even used that myself. The support program also does a lot of different socials to, bring Asian folks together. Um, who are living with HIV, so they feel you know less isolated, because a lot of the issues people living with HIV face is stigma and isolation. So they help with that. So that's a support program, and then we have something called Queer Asian Youth. And so that one is not specifically only for people living with HIV, but it's more for the youth, the queer LGBTQ Asian youth in our community, and yeah, serving the young folks basically. Again, there's a lot of stuff and it's actually run by a wonderful person named Danny Ko, and so they run that program. And again, it's they do a lot of sexual health education and awareness, social events, right? And so that's for youth. and they're a really fun bunch. One thing that always amazes me about the Queer Asian youth is like there always seems to be like a lot of artists in that community, and they're always doing like a lot of really cool things. Like they had I think they organized like a poetry slam last year, which was really great. So yeah, creation youth is really great. We also have a men's sexual health program run by a really awesome colleague of mine named Supre Lee. And the reason why that uh, that project is very important is because HIV does tend to uh, affect gay men disproportionately. So yeah, so they have that, a lot of different socials. Like one of the big events they do every year is called Slam, which is uh, Sex Love Asian Men. I believe that's what the acronym is for, but it's like a sexual health program. Um, a sexual health forum where gay Asian men will get together and there'll be a whole day of just talking about different topics related to sex, like HIV prevention, for example, mental health, right? Because of a lot of connections between sexual health and mental health. Um, yeah, and then we have a woman in trans program, which is, again, serves trans women. Oh my gosh, we have so many things. We also have a international student program. So I believe they call themselves the International Rainbow Student Coalition. No, International Students Rainbow Connection, right? And that's for international students, Mandarin speaking international students. Um, and I remember I told you that we get a lot of immigrants who come here, right? We also have a lot of international students who come here, right? And again, when you don't have the language, when you're new to Toronto and you're just a student here, um, it's important that these students are able to network with each other, right? And have those services. We also have Asian migrant farm worker program. And so, because we have actually quite a few Asian migrant farmer workers in Ontario. And we have a person, his name's O, and he's from Thailand, really wonderful person. And he actually goes there and does a lot of work with the migrant workers there. I'm just trying to figure out what else we do. We do yeah, and then the harm reduction, which is what I do, which is basically educating um our community about drugs and harm reduction. Because again, in Asian culture, there's a lot of stigma around that. And so that the work I do is a lot of awareness. I do make a lot of posts about social media posts, and I organize events for people to come learn about that. And actually, before doing this work, I was actually also the HIV self-testing promoter at ACAS. So we were, I don't, a lot of people don't know this now, but but you can actually test yourself for HIV. And yeah, and so I was doing that for a while as well. So I'm probably missing a bunch of different things at this point, but there's so many things that we do,
Oh, but I gotta say that
and it's
I'm
hard to
amazed.
summarize it. Yeah, I don't even know how I remembered all that. It's but we do a lot of stuff, and we have a really wonderful team. But yeah, like a lot of our stuff basically is our work is just based in HIV and AIDS prevention and sexual health education, and but working very specifically, especially with Asian LGBTQ folks. Actually, if you Google Asian LGBTQ organization, if you Google that, the organization that actually pops up is ACAS. So I think a lot of folks looking at us will only look at us as like a HIV/AIDS organization, but definitely we are probably the biggest LGBTQ Asian organization in Toronto. Yeah.
Honestly, it
So
looks
sorry
like
for
it.
that sorry for that long rant.
No, but I mean, come on, it was necessary, and I'm pretty sure that you just covered like basic things. We haven't talked
Yeah,
about everything yet.
yeah. I mean, there's a lot of different things we do too. Like we do a lot of like research stuff too. Like there was actually like this champ program that we did, which was about HIV stigma, like challenging that. That was a mental health thing that we did a couple of years ago. But and I actually worked on that. I can't remember what I did on that. I've been man, I was working with ACAS for like 5 years now. But yeah, like we also participate quite a bit in research and health promotion. And actually, we have a wonderful person in Cancun. He does a lot of the health promotion at ACAS. Yeah, so we do a lot.
You
Yeah.
do. You do. And I'm actually going to tell people to learn more about what you're doing, like in depth, or at least if you maybe if you need help, if you know someone that could profit from this, go check their page, guys. It's ACAS, right? ACAS.org. Pretty simple, that easy. And you can get information in there in so many languages. This is a point to highlight. So you can easily understand what's going on. You can get informed and you can get in touch. We try to touch some base here with what you guys are doing in there. But again, it's an
Mm.
immense body of work if we think about it. And again, thinking of it, it's all on the necessary stuff, right? We are not like trying
Oh
to
yeah.
go much far, like reinvent the wheel. It's basically saying, hey, we need to kind of separate those things and give it special attention, but that's it. That's all aspects of life. So let's deal with this.
Yep. Yeah. And I think I mean, and again, and like I think the main thing about our services and what we do, it's all about community, just creating a space where, again, queer, Asian, HIV positive folks can get together. Like for me, for example, being a gay Asian man living with HIV, ACAS has been so important for me in terms of, finding myself in my community. Like when I got diagnosed with HIV, in 2017, it was within a year that actually I started working with them because actually I ended up going back to school after my diagnosis. I ended up going back to school for social work at Georgetown College, and I did my internship there. And I'm telling you, like, it was the first place in Toronto ever where I felt like I belonged somewhere, like truly belong somewhere. Because even like even within the gay community, right, with HIV, I'm often stigmatized quite a bit, right? And and so yeah, ACAS has been very valuable to all people like me, you know. Yeah.
Well, thank you for sharing, Justin. Really, I feel like we
Hmm.
often forget how lonely these things can be. Not just, with the diagnosis, which I have no,
Oh yeah.
honestly, I cannot even imagine how that feels like. But sometimes it's this feeling of not belonging anywhere, of like
Oh
being
yeah.
basically a dust in the wind. It's so cumbersome.
Yep.
It's so lonely and it's so heavy. So thank you for
Yep.
sharing your story.
Yeah. And the people there are so kind, like, and we provide each other emotional support, right? Even the staff, right? I mean, amongst community members, I mean, there have been so many times where I would be going through something, right? And I would just be able to talk to my we have a new ED now, but like for example, our former ED who's retired down the look, like whenever I would go through something, I would talk to her about it, and she was so kind and caring towards me. She'd be very understanding if I wasn't able to work uh because of mental health and stuff like that. You know. But even just like, yeah, I mean, we all support each other so much because being queer, being Asian, um, being HIV positive, those are all like put all those intersectionalities together with, you know, treatment you get from society, it can be hard. So it's like it almost feels like at times we're a little bit of a lifeboat in a way. in a sea of social injustices, right? And we really help each other, you know? Yeah.
Well, I'm happy you guys are there. And talking about
Yeah.
this, how can we tell our listeners or everyone else watching us on YouTube right now to help you guys out, to help you keep going and growing, right? What are the best ways?
Yes. Yeah. So I mean, you can volunteer with us if you like one things you can do is you can actually email us at the email is, let me just try to remember. The email is, I mean, if you can email us at info@acas.org. Um, uh, but we also have a volunteer email, and that's volunteer@acas.org. So if you want to volunteer with us, that would be great. If you actually come to our website, www.acas.org, we also have a link for donations if you want to make donations. Also, like follow our social media. We have many different social medias. We have the main ACAS social media account, and I believe right now we have like 1,500 followers right now. But like follow us there. It's ACAS Toronto. That's basically it. ACASTORONTO. That's our and that's a if you really want to get involved with us in terms of volunteering or just coming to our events or just learning more, follow us on social media there because that's where we post a lot of information about events that we have or sexual health education. Um, I also have for my program harm reduction underscore ACAS, and that's you can follow us there. There's information about that Queer Asian Youth also has Instagram account, Queer Asian Youth, and they advertise their events there. And also we have another Instagram for the international students that's called IS Rainbow Connection, IS Rainbow Connection, International Students Rainbow Connection. So if you follow us on those social media platforms, yeah, I mean that is just a really wonderful way to get involved with us and find out what we're doing. Because also sometimes we'll put out there like a call for volunteers or help for something there too. So um, yeah, that's a way to help. But also I think like a really great way to help us in our work is just kind of you know educate yourself too about HIV and in general, just like try to, if, for example, like there's so many myths about HIV, like that you can get HIV from um, uh, like mosquito bites, right, or spit and things like that. You know, if you hear people saying things, or actually one thing as well, like one of the things people don't know, for example, is that U equals U, untextable equals untransmissible. People living with HIV who take their ARV medications every day, their viral load is so low it becomes undetectable on a lot of on a blood test, um, and they actually cannot transmit the virus to anyone else, right? So you can actually live with HIV and not give the virus to someone through unprotected sex, right? You can have children, you can have a partner, so that's just not, it's kind of educating yourself and your friends about that and challenging when people say stigmatizing things. Not only helps our community, but it helps all PHAs around the world, people living with HIV, right? So yeah, those are some ways to support us. Yeah.
Thank
Okay.
you for sharing all of this information with us. I feel like with time and generations, this all that happened, right? All the importance of this and everything that comes with this disease has been kind of faded, I would say. Like we have stopped talking about it. So thank you for including this very vital appeal here for us all to get more educated about it. And thank you so much for joining us today. This was a really wonderful conversation, Justin.
Yes, thank you so much.
And for everyone listening or watching us right now, thank you for staying with us for one more episode. And remember, if you enjoyed, press subscribe on YouTube or in your podcast app because that shows the algorithms that this is an important conversation, so more people can learn about the importance of the Asian community aid services. You can get the link to get to them on the description of this episode. All right? Bye, and I see you in the next episode.